Good afternoon. I now call the House Standing Committee on Appropriations and Revenue, the Wednesday, September 8, 2021, in room 154 now called to order. A few housekeeping measures. If you can, please turn off or mute your phone. When the roll is called, please indicate if you are in the room, if you are in your annex office, or if you are remote. At this time, clerk, please call the roll.
Representative Beckler.
Right here.
Representative Bentley.
Here, present in the room.
Representative Blanton.
Present in the room.
Representative Bridges.
Here in the room.
Representative Dossett.
Present in the room.
Representative Fisher.
Here in the room.
Representative Fleming.
Present in the room.
Representative Flood.
Present in the annex.
Thank you. Representative Fugit.
Here in the room.
Representative Gentry.
Present in the room.
Representative Hale.
Present here in the room.
Representative Hart. Representative Hatton.
Present in the room.
Representative Nemus.
Present in the room.
Representative Palumbo.
Here in my annex office.
Thank you. Representative Prunty.
Here in the room.
Representative Raymond.
Here in the room.
Representative Riley. Representative Santoro.
Here in the room.
Representative Tipton.
Present in person.
Representative Wilner. Representative Reed.
Here in the room.
Chairman Petrie.
Present in the room.
Mr. Chairman, I'd like to go on record as being here.
Thank you, Mr. Representative Hart. Anybody else? We good to go? We have a quorum. All right, we have a quorum and duly acted to move forward today. Today on the agenda, we have one item and one item only, House Bill 3. At the table, we have Representative Petrie. Mr. Representative Petrie, will you please introduce yourself for the record?
State Representative Jason Petrie, House District 16.
Will you please raise your right hand? Do you swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Please proceed.
Thank you, Mr. Chairman and members of the committee. We have on House Bill 3. Hopefully everyone has looked through it. I think it was presented in the Senate committee maybe in the preceding hour. I will summarize it only, and then we can answer any questions as necessary. First off, if you will look at Section 2 of the bill, you will see that there was an appropriation of $575 million for what we would commonly refer to as unemployment insurance purposes. That sum that was originally appropriated was not needed in full, so that is being reduced to the amount that was only needed for that purpose, and the amount of the decrease in that appropriation is the amount being appropriated through this bill in Section 1. So you'll now see in Section 1, $69,268,300 being appropriated to the Health and Family Services Cabinet. Use of the funds shall be prioritized by the bill, but it is not required. It's not an exclusive prioritization for critical healthcare need areas related to COVID. So you'll see in 1A, testing for various purposes, 1B, assisting providers and establishing a monoclonal antibody treatment and making sure those treatments are given. 1C, providing means for test and stay, which has been discussed under the education rubric so that that can be facilitated. Section 1, number 2, makes clear that any other pandemic fund source that's available, whether it be CARES Act money or whether it be something else of which we're not even aware at this point, should be utilized before we use this appropriated money, and this appropriated money comes from American Rescue Plan Act, ARPA funds. That was the original appropriation, remains as such. So ARPA funds should be used last. All other funds should be, source funds should be used first. 2B makes that more clear to make sure that the ARPA funds are used in accord with Treasury requirements and guidance that may be to be issued. No administrative fees or salaries or personnel salaries to be used for this. Section 2 we've already covered. Section 3 places reporting requirements on the cabinet to report back to the Legislative Research Commission and the Interim Joint Committee on Health, Welfare, and Family by December 15th of this year, saying how was the money used in particular relative to COVID tests, monoclonal antibody treatment, and the Test and Stay program. Section 4 declares this an emergency appropriation, and as you know, and for the public's interest, this would go into effect upon final conclusion in this special session. And if there are any questions, I'll be glad to attempt to answer them.
The chair recognizes Representative Flood.
Thank you, Chairman. Gentlemen, would you be so kind under section 1B, where we talk about the antibody treatment centers, are those going to be in established healthcare entities already, or will these dollars be available to create brand new centers? That's what I'm wondering about.
I think the spirit of this and the conversation is consistent with this. At first, the conversation was to establish centers. The state government would establish those centers, fund them, and operate them. I think with a shortage of personnel and other logistical issues that has been pulled back to state government is in a support role. So that there are, in fact, multiple existing centers or hospitals or medical providers that have infusion centers or monoclonal antibody centers already. And I think, as my best information currently is we do have at least one, and we have usually multiple of those providers that can provide this treatment already in each of the AD districts. So I think we've already got a good spread, but this is supposed to allow the administration ability to go, okay, we see a particular need here in this particular region, or if they have an SOS call of please help us here, whether to obtain materials, personnel, or facilitate some kind of logistical difficulty, this allows the administration to do that.
Thank you, Chairman.
You're welcome.
Chair recognizes Representative Blanton.
Thank you, Mr. Chair. Question, please. You mentioned personnel, Representative Petrie. Could this money be used to help hospitals in hiring staff? And in my area, my local hospitals are experiencing a great increase in pay for a term typically known as travel nurses. Went from $80-some an hour to over $200 an hour, and they are reliant mostly on Medicaid, Medicare, which means that their income levels are staying stagnant, but yet their cost of employees has increased dramatically. So will these funds be able to be used by the hospitals to help with personnel?
To try to answer your question as directly as possible, and I think I may have to give a little explanation around it, okay? First off, the funds as set forth in Section 1 are directed toward, not exclusively given, not exhaustively given, but there is discretion given to the administration to adjust the number of funds, how much, the amount, as well as what activities it should be directed to. If it's not otherwise forbidden by law, then yes, that could be a permissible use. I will make sure that everyone understands this. There were original conversations, and you're all aware, of around $150 million on this appropriation. And I think part of that had to do with the very issue that you're speaking to. We do have a shortage of staff in Kentucky, and then I'm going to give you my rendition of it and the way the thought process seems to work. In dealing with COVID in particular, ventilators on beds is where the real crux of the issue is. That's where someone is going to be treated in their most dire circumstances. A normal, ordinary RN without training for intensive care or critical care on vent or ventilators can't cover that legally for liability purposes as well as basic skills. So that's not a fungible position. Of those ICU, CCU nurses that are available to staff those positions in Kentucky, I'm unaware of any significant portion that is not already in the workforce. So it's not like we're going to pull people out of the ground that are just there. They may be retired. If they are, they're probably elderly or they have an underlying condition, which probably means they don't want to be around COVID or shouldn't be around COVID. So we don't have a lot of idle ICU and CCU nurses. Of the nurses we have, some are on contract in the state, some are on contract through agency out of state. And when I say on contract, everyone understands that that's a legal contract. Most of those contracts on average are going to run about 12 weeks. So if we have a shortage now because of out-of-state contract work, somewhere close to 12 weeks, 10, 12, 8, 12, we're not going to be able to draw those people back in with any amount of money, reasonable amount of money, because they would have to break a legal contract. They would have to break agreements with their agency that placed them. They would have to break trust and agreement with the hospital association, not a particular hospital, but a hospital association that may have 16, 20, or 200 entities affiliated. That's not going to happen. How are we going to pull people back in, and the timing of it? Best modeling I see, and I pray that this is accurate, by mid-October, we should peak on our numbers and should start coming back down. And I pray that's accurate. I can't speak to the veracity of that, the accuracy of it, but that's what it seems to be predicted at this point, and I pray that that's true. If that be the case, then by the time people come off a contract and by the time this money gets let out and actually hits the ground, we may be too late to the game, the administration as well as the General Assembly. So as you can tell, that $150 million conversation came down to $69 million, and see also that in the call of the governor, as we all know, that call sets what we can and cannot look at and take upon as issues in a special session. So if you look at number 7 of that call, there is a specific dollar figure that's put in there that equals the sum that's set forth in section 1. Does that answer your question?
Yes, sir. Very good answer. Thank you. Thank you, Mr. Chairman.
Chair recognizes Representative Bridges. Chair recognizes Representative Fleming.
Thank you. Chairman Petrie, could you explain that again a second ago? No, I'm just kidding.
If you want me to, I will, Mr. Chairman.
I'm good. No, a serious question. In terms of the $69 million, has those funds already been appropriated in terms of identifying how much each one will cost that will make up the $69 million? And then, in addition to that, how will that be tracked? I think we know, but I just want to make sure I'm clear about how they'll be tracked and accounted for.
Good question. No, it is not bucketed within that $69 million. So it was appropriated earlier. Talked about the reduction from an earlier appropriation from ARPA for UE. This has been repurposed to healthcare, COVID related. You'll see nothing in here that silos or buckets that $69 million. So there is wide discretion given to the administration of being able to nimbly adapt the funds where the need is, whether by category or whether by amounts, and that's by design.
And that those funds are restricted just for those categories that's laid out in the bill or in the Section 1.
It is restricted in Section 1, as it says, the General Assembly is prioritizing funds toward critical healthcare need areas related to COVID. And then we list 3 specific areas for prioritization. That is not an exclusive list. That is not an exhaustive list, but is a statement of at least 3 priorities.
Okay. And we'll get a recounting of that later
And yes, we will. And just for public consumption, if nothing else, if you look back at Section 3 of the bill, that's where it says by December the 15th, the cabinet will supply us with reporting of at least certain measurements.
Okay, just want to clarify that. Thank you, sir.
And then I will just say that we will be tracking this to find out where everything's spent at so that we can understand better.
Chair recognizes Representative Hatton.
Thank you, Mr. Chair. Representative Petrie, in Section 1, let's see, C, the test and stay provisions. So I understand that the test and stay provision has worked well for at least one county, Greene County, but they're pretty small. Some counties, like mine, don't have a school nurse for every school. We're sharing them, and they're already pretty overworked. Some counties are huge, like Jefferson County, and would have a lot of trouble complying with this. I just wanted to make sure that it's not mandatory, right? It's something that will provide money if schools want to opt in. Is that correct?
That is correct. I go back to an earlier statement that this bill is actually a supportive bill. It doesn't require certain programs to be established, whether it be for staffing issues or for test and stay, but it says these are issues of which we are aware. We're giving a discretion to the administration to address categorically a broad range of issues. We're prioritizing focus on certain ones, but it's nothing here, nor does the intent behind it speak to you have to do these things. This is a supportive role, not a pull-along role.
Thank you.
Chair recognizes Representative Tipton.
Thank you, Mr. Chair. Representative Petrie, thank you for your work on this. And I just want to reemphasize what you said for those who may be watching across the state. This legislation does not appropriate new dollars. It is repurposing dollars
Correct.
that have already been appropriated by the General Assembly in the 21 session from
Correct.
the federal ARPA funds.
Correct.
But I do have a question. Do you know what the current balance is in the Unemployment Insurance Trust Fund?
I do not.
Okay.
I can assure you that in conversations, I made sure and others made sure that this reappropriation of funds that were designated first for unemployment insurance will not hamper, hinder, or otherwise stymie unemployment insurance benefits or that program in full.
Seeing no further questions, the chair will now entertain a motion for passage of House Bill 3.
So move.
It has been properly moved and seconded. When the clerk calls the roll, please signify by saying aye or nay. Clerk, please call the roll.
Representative Beckler.
Nay.
Representative Bentley.
Aye.
Representative Blanton.
Aye.
Representative Bridges. Representative Dossett.
Yes.
Representative Fisher.
Pass.
Representative Fleming.
Aye.
Representative Flood.
Yes.
Thank you. Representative Fugit.
Yes.
Representative Gentry.
Yes.
Representative Hale.
Aye.
Representative Hart.
Yes.
Representative Hatton.
Yes.
Representative Nemus.
Yes.
Representative Palumbo.
Yes.
Thank you. Representative Prunty.
Yes.
Representative Raymond.
Aye.
Representative Reed.
Aye.
Representative Riley.
Yes.
Representative Santoro.
Pass.
Representative Tipton.
Yes.
Representative Wilner.
Yes.
Chairman Petrie.
Yes.
The ayes have it. We have 20 yea votes, 1 no vote, and 2 pass votes. The motion passes on House Bill 3 to report it to the House floor favorably.
Mr. Chairman, thank you, and thank all the members for taking this up on today and putting your time into it, and all the other ones we're working on. Thank you very much.
Meeting is adjourned.